In recent decades, antimicrobial resistance, or AMR, in bacteria has emerged as a public health crisis worldwide. It is one of the top 10 global threats to public health, with the World Health Organization estimating that bacterial AMR was directly responsible for 1.27 million global deaths in 2019 and contributed to 4.95 million deaths. The root cause for bacterial AMR is misuse and overuse of antimicrobials in humans, animals, and plants as it develops drug-resistant pathogens, putting many gains of modern medicine at risk. That is, making infections more difficult to treat and makes other medical procedures and treatments much riskier. AMR affects not only humans, but also animals and plants. This is referred to by global health professionals as the One Health issue. While medical institutions around the world seek solutions to curb this problem, Prof.Dr.Rungtip Chuanchuen, head of the Department of Veterinary Public Health of Chulalongkorn University's Faculty of Veterinary Science, was capable to decode drug resistance in animals.
We did metagenomic sequencing analysis for bacterial community in airborne dust from pig farm, and we found that more than 1,600 bacterial species with at least 150 antimicrobial resistant genes are widespread in the airborne dust. So this could pose a risk for humans and animal health, and also it tells us that we need policy measurement to address AMR in the environment.
This leap towards sustainable solutions to deter AMR has granted Professor Rungtip the National Researcher of 2022 award. But the head of the Department of Veterinary Public Health says the mission is still far from complete, as danger still continues to creep in closer.
AMR is a dynamic threat, but the AMR research to lessen this threat is lagging behind. So we have to strengthen AMR research to strengthen AMR solution. We have to accelerate One Health AMR research to fill the gaps to address AMR. And if we don't act right now, our antibiotic cabinet will be empty. That means we will not have antibiotics to save our life in the future.
For Thailand, preliminary studies have found that deaths from drug resistance have reached a record high of about 30,000 people annually, while the World Bank estimates that AMR could result in $1 trillion additional healthcare costs by 2050 and $1 trillion to $3.4 trillion gross domestic product or GDP losses per year by 2030.